You're welcome.
Good afternoon.
Hey, Sheila.
Hey, Tiffany, how are you doing?
Doing all right. How about you?
Doing okay. Several of our team got COVID, and including me. But this is, I'm in quarantine and doing okay. So on those antiviral medication, and so that's pretty gross. But I had a couple bad days, but getting better every day.
That's good. Well, I'm sorry to hear that. We've
Yeah.
got quite a few folks on some teams I'm on. When we started going back in person, that seems to be happening more and more.
Right. Yeah, we'd had our a meeting, site visit actually to Marshall from the umbrella project that we work on, and it was about maybe 14 of us in there, and I think there's been 4 or 5 of us that tested positive. So,
Oh no.
and Regina had her mask on, and she had it. She got it. So, but we're vaccinated, and that's the main thing. And so hey, Stephanie.
Hi, how are you today?
Doing okay today. I'm having some stomach issues, so if I jump off here, don't know why. Because today's day 2 of the antiviral medicine. And so that's, yesterday I didn't have too bad of a stomach issue, but today has been a little different. And
how about your husband? How's he?
Timmy's doing good. He was being treated for bronchitis and all kinds of things, but he tested negative. So,
What's the number up to now? How many from the group? Do you know?
I think there's 5. I think there's 4 or 5 of us. Mary Glenn tested negative for the 3rd time. So she was so sick.
I know.
So yeah.
Yeah.
Yes.
Well, you guys, so much for using sick time. Yeah. You guys worked so hard yesterday.
I know. I mean, we get out there the first time, and we all get sick. So, gosh, I don't know. And who knows where it came from? I mean, we had, people from all over there, and Washington, D.C., Colorado, Florida, Kentucky, just crazy.
And Regina had been traveling for days before.
Right.
You just don't know.
Right.
Hey, Tiffany. Hey, Tammy. Hair's getting long, Tiffany.
Yeah.
Looks good.
Again, it'll be time to cut it off soon.
Hey,
well, that's nice
will
that
you be
you
sharing your screen?
I sure will. I can do that. No problem.
Let me make sure that I've got you authorized to do that. So see, how do I do that? I'm looking for the,
Usually I think you have to make me
At the
co-host, but
top.
I can test it. Hang on a minute.
okay,
Let me test and see if I can do it. Let me put it
sure,
in presenter view
okay.
and then see if I can share screen. Nope, I have to share screen and then do presenter view. Okay. Okay, Zoom's being interesting. I think I'm seeing someone else's share screen. Yeah, I'm seeing your share screen.
You're seeing mine. Okay, so let me stop mine.
Okay.
See if I stopped mine.
Can you
And
see
there
that?
you are, right?
And let me turn it to presenter view. Now, do you
Okay.
see, what do you see on your screen right now?
I see your first slide.
Okay. Are there
mhm.
notes and other slides or anything, or is
I
it
don't see any notes or anything.
great?
No.
You're seeing the correct.
Yeah, I think it's correct. Yeah, I think this is exactly what we want to see. We still have a few minutes and then I'll introduce you. I don't think Sierra will be on here today. I know she's graduating this month, and so just moving on.
Nothing important.
Yeah.
Super important. I'm pretty casual. I like just to have a conversation. We were on this morning and we did 2 webinars yesterday. Well, we had 2 presenters on our webinars yesterday, and Zoom wasn't being the smoothest, but I like to have conversations anyway, more than
Yeah, and
yeah.
I think Regina sent you the registration link, but I did have someone, sometimes not, I don't think everybody registers. They just,
Yeah, just show up.
hop on because they don't know if they're going to or not. So they don't want to feel bad if they say they're coming and then they don't.
Mhm.
I did have one gal from Kentucky message me this morning and told me that she's going to be on the road. Her schedule changed. She didn't think she was going to be able to make it. Self-service kind of, iffy, which we all know.
Yeah.
We all know how that goes.
Yes. Yes, we do. You all usually put these on your YouTube also, probably,
Yeah,
right?
we do.
Yes, and it's in the record mode.
Great. Okay. So
I
what?
believe,
Yeah.
we've asked the host to give you permission to record. I think I heard that as I was jumping on. It said recording in progress.
Cool. So I'm assuming whoever YouTubes it can trim out all the conversation in the beginning.
Mm-hmm.
But yeah, so Wilson, you all have the slides. The last 2 slides at the very end, those are just the website slides I was working on. So those, it's not going to hurt anybody to have those, but I meant to delete those before I sent it.
Sure. Okay. Yeah, and I'll just share those once the link is uploaded, and we'll get them out, to everyone.
And I'm just going to let you know now, our latest foster is a baby lamb and she is very loud. She thinks she needs her baba. She is very loud. So,
How many do you have?
we just have the one. She from a friend of ours, one of my friends and her husband, they actually have a production farm where they have 100 sheep or something. And so this one came in and her mom, who's like 78, had been bottle feeding. They had 7 bottle babies that they had gotten from another farm, and this one wasn't doing well. And so her mom is a sweet lady, and she was just like, oh, they're gonna have to put her down. And I was like, oh my gosh, we usually foster cats and dogs. Let's see what we can do here. So we took this little lamb and she's going to be just fine, and she's going to go back to her little farm home this weekend. But for a few days, we've had her for a couple of weeks on a bottle and antibiotics and everything, but she's gonna be fine. But gave her a chance to live, and she wouldn't have had that had she gone. And the poor lady, she was crying, and so there was no way I wasn't bringing this lamb home to my yard. She's actually smaller than my dogs, so that was kind of funny. But
That's nice. It's a nice project.
So if you hear her talking in the background, she's pretty mad because I have my office door closed. She likes to lay in front of the door. So
Okay. Okay. Well, if you hear a dog, you'll know why.
hey, Regina.
Yeah. Hey, good morning, Regina.
Good morning.
Yeah.
Hi, Regina.
Hi.
So good afternoon, everyone. I think we'll go ahead and get started. It is noon. And I want to welcome Tiffany Pittman. She is with the School Mental Health Coordinator with Marshall University School of Health Technical Assistance Center, Division of Community Health. Tiffany earned an MA in counseling at Marshall and is a WVLPC and AADC, and I don't know what all that stands for, Tiffany, but that was on your bio. With 20 plus years experience related to school-based mental health. She was awarded the 2019 WVAADC Counselor of the Year. Woo, Tiffany. Tiffany provides consultation and technical assistance related to site needs assessment, program development, strategic planning, grant writing, selection of evidence-based practice, and training, along with a myriad of other topics. Current projects include work with expanded school mental health, substance use prevention, and early intervention. West Virginia Aware, telehealth, and more. And we welcome Tiffany Pittman, and we welcome everyone this afternoon. Tiffany will be talking to us about improving mental health outcomes in rural communities. And if you guys don't mind, if you could just, in the chat box, just put your name and the organization and state that you represent, and we will move forward. And Tiffany, I know we'll have questions at the end, or you want to we'll mix them in. And if you do have questions, you can put them in the chat, but we'll have open house time for you guys to just chime in when Tiffany gives the okay. So Tiffany, I'll turn it over to you, and welcome everyone.
Everyone. So as I'm sharing the screen, and just to say that I am not a super formal person, so please don't hesitate to ask questions, unmute, talk. And for those initials, LPC is licensed professional counselor, AADC is advanced alcohol and drug counselor. I have to even think about my initials after all these years, but so all that to say, I work with students. Typically, I was a therapist doing trauma work for a number of years. Some of that was reconciliation. I am specifically interested in some of the diabetes care work because I had a young lady who was a wonderful young lady of mine that I met in a school, and she had an insulin pump, and I knew her and her family for many years, and they were great people. But I saw firsthand the challenges that family had in receiving good care in a rural setting and good support from their school system. I'm going to say it like that so that it's tactful. But basically, they struggled a lot. There was a lot of advocacy that the mom had to do and things of that nature for what you and I, well, what I would consider would just be a normal day of, getting the care you need in the setting that you need it. So they're good people. But so I got really interested in rural health, and I ended up at Marshall, but I've been in a variety of settings, including what you call lockup and schools and pretty much anywhere. So please jump in and say anything. If this is off topic for you, or if I use too many acronyms, catch me, call me out, tell me about it, because I don't want to do that. So the first thing that the ladies had asked me to talk about was mental health outcomes in rural communities. So that's pretty much what I've done. This is me. I'm not going to reread all that fun stuff because Sheila did a great job. But one thing that I would like to know is more about you all. And I see that you're putting your information in the chat box. So I appreciate that. It looks like we have a variety of different locations: West Virginia, Kentucky. Ooh, out of state. I love that. Okay, great. So if you don't mind, do say who you are in chat. And like I said, speak up anytime you want. So the objectives, I'm not going to read the whole slides to everyone, but the objectives today is that We do want to learn a little bit more about mental health supports for rural communities. I'm happy to answer specific questions. The barriers. Okay, so I'm a big fan of the National Rural Health Association website, and there's one called RHI Hub, Rural Health Information Hub. Anyway, I'm big fans of those two sites. They are, well, they offer a whole lot of resources and things, and I'll have that at the end of the PowerPoint, and everybody can have the PowerPoint. I've sent it to our team, so feel free to not have to copy anything. But so we have four main barriers, really: accessibility, availability, affordability, and acceptability. I guess we could call it the 4 A's, according to the National Rural Health Association. All right, so my approach is, yes, we have the barriers. All right, now what do we do about it? Okay, so my first step is to think about, have a conversation. Do your gatekeepers use screeners? And by gatekeepers, I mean anybody that might be the first line with families or students or even adults. And that can be primary care providers. A whole lot of folks, when I see students, sometimes they come in because they have tummy aches, but they have a tummy ache every day for 6 months. That's probably not a tummy ache. It's probably something else. The first thing I ask the nurses and the doctors is, did you do a full workup, a full medical workup, blood panel, blood sugar? Did you do all that? Did you see if there is an environmental or a medical cause for what has this young person down? In the example of my student, she got referred for behavior. That's typical. Behavior problem. There's a behavior problem. I'm like, do you know what her blood sugar was? I can tell you exactly why she was having a problem and why she was falling asleep in class and why she was acting out, because she wasn't regulated. And so part of that work was working with the medical providers to help her maintain a regulation when she was at school, because that was, this wasn't a behavior or a mental health problem. This was a primary care concern. And then we could get to the mental health and the other supports. So I just want to say that that is very important. And those are folks that we network on a regular basis. And school mental health is any adjunct services. And what I'm saying adjunct services, I mean anybody that touches a student or a family that has the opportunity to have a positive impact. So we do talk to youth shelters, any civic offices, things of that nature. Are you trained to recognize trauma? Are you trained to recognize abuse? Do you know what to do if someone approaches you and says they are suicidal or homicidal? It's important. So given that, have conversations with your gatekeepers. Do they use screeners? What screeners do they use? The personal health questionnaire too is really popular in outpatient settings, and that's a 2-question. Are you safe? Have you had negative impacts? But we even have we have faith-based after school communities in our area. It's very popular in our area, and so we train them on trauma care and how to recognize signs and symptoms and things of that nature. So first step, talk to everybody who touches a student or an adult that has the opportunity to improve their life. Secondly, educate your communities, get local and stay local. You've all probably, I'm looking at where you're from, a lot of you do these sorts of things and you're probably really good at it. And so, but engaging communities, because we can't make that change in a bubble. So when you're talking about mental health care, educate them, make it more normal. We'll see that that's going to come up. Normalize this. It should be a part of every conversation. That's my opinion as a therapist. So maybe I'm on the wrong soapbox, but I don't see people aren't medical issues, and they're not mental health issues, and they're not substance use issues. They are humans. And so I feel like we have these conversations to educate communities, talk to folks, get local, find your local people who are already sort of having those conversations or who can have the best impact. Food banks can have amazing impact. And like I said, after school programs and things like that. Partner and collaborate. Transportation is a huge issue in rural communities. So who has transportation hubs and networks? In our area, we have the Cabell Wayne Association of the Blind. We can make They're fantastic. They provide transportation to and from places. I have a parent who uses this transportation. We were like, hey, what do you know about mental health? And so just a brief conversation with somebody there, and they're like, not a lot. We would really love to know more. Great, let us partner. And also set up substance use and mental health providers. Are they at the table for your events? If you are having a big primary care or health fair, are your mental health and substance use disorder prevention folks, are they at the table? If they're not, invite them, please. If you partner, you're going to find larger funding options. I will just say that there is a lot of money out there for certain approaches, and partnering. Regina and her team, I think they're very good at saying, hey, we don't want to forget the mental health supports. We don't want to forget this. We don't want to forget that. The more partners you have, the more you get the word out, the more normal it is to seek support and help for such things. Okay. So if you have nonprofit partners, use them. And they in turn will lean and partner with you. And so that's very important. So reaching out, one of the biggest outreaches we have is social media. And I know I am not the biggest fan of social media. I'm not going to lie. When Twitter came out, I was like, I have no clue what that is or how to use it. So I called my son, who's 27, and I said, teach me this Twitter thing. And he said, oh, Mom. And I said, look, it's where you all are. It's where the highest risk groups are. We're on Facebook, they're on social media, on Instagram, and for goodness sake, TikTok, it's addictive. Folks are there. Twitch, social media streams. Find out where folks are and meet them where they are. I will tell you, my parents are 70s and 80s, and they probably check Facebook more than anybody. So if there's a community fair, they're going to Facebook and they're going to know it because the health department is having a community fair. Cabell Health Department, good job. So they will stalk you and they will find your posts and they will show up at your places. So, and if you don't know how to do it or whatever, listen, when I have a grandkid, I'm just going to have them hook me up with the social media and have them do my posts for me because they're the ones who know how to reach the folks of that, of a certain age group. If I want to reach folks in my mom's age group, I ask her, what would you look at? What would you read? How would I reach somebody like you if I was trying to reach somebody in a rural community? And they'll just tell you. So the second thing I'd look at is I like to find champions. When we reach out, I look at federally qualified health centers. I look at comprehensive behavioral health centers. I call family resource networks in the rural areas and I say, tell me who's doing the work in your area for mental health or for substance use prevention or for whatever it is that I'm looking for, because I'm not there. And so I call them and I say, who is it? And I call those people and I look for atypical partners. And what I mean by that is I don't always look for the biggest. I don't always look for the biggest provider and the person who sees everybody. Sometimes I will call these little tiny providers and I say, look, I know that you are an outpatient therapist. However, we're having a community get together. We're having a community forum where people listen. I have a school that is desperate to meet the needs of their students because they've had successful suicides. What can you offer your community? And how can I support you in supporting your community? And I'm going to tell you what, when we have what I want to call the 911 calls and we gather communities at a school setting or in a community setting, they show up. They show up because they care. And it's amazing what you can accomplish just by engaging people that you would never think about engaging before in these mental health, in the mental health outcomes. So when we find a community that has nobody, and I mean 2,000 people, 200 people, there's nobody there, then we try to partner them with telehealth. And I'll be honest with you, some of the teachers that we work with, some of the professionals and some of the students we work with, they prefer telehealth because it's in those communities, everybody knows the one therapist that's there. Could be their grandma, it could be their cousin. They don't want to go talk to my neighbor about, what our personal family secrets are. So sometimes they prefer that telehealth, and we try to connect them with funding so that they don't have to have a lot of out-of-pocket pay for telehealth. There are telehealth providers that will take Medicaid and Medicare. So it's a lot about knowing what your local resources are and getting them at the table. And that's outreach. All right. So when we talk about increasing acceptability, normalize. We want it just to be as normal as anything else, as getting your teeth cleaned, as going to your doctor. If you have a cold, you get your Tylenol. Mental health, normalizing mental health in conversations and communication, whether you're talking just daily conversation with somebody or in the media, it's as necessary and normal as anything else. And sometimes when I'm talking to folks, I'll say, given all the upheaval in the past few years, I don't know anyone who's not very stressed right now and who doesn't feel a certain amount of anxiety. And, it's absolutely normal. I mean, look at the grief and loss. Or in one community, I was talking to folks and they're like, yeah, we don't really need therapy. And I said, I noticed that you had 8 deaths in your immediate community. Your community of 350 people, and 8 people passed away this past year. Is there anyone in your community that wasn't touched by that grief? And they got very quiet and they said, no. And I said, then let's talk about that. How do we support these students? You're adults and you're feeling that impact. Imagine if the students in that community, what if this one young lady, she was their teacher? What are we doing to support these students? So it wasn't like, oh my gosh, you're so horrible, you need therapy. It was like, wow, I can't imagine the amount of grief and loss that you have had. How do we support you? And some of them will say, we don't need therapy. Fine, great. Let's do some just conversations about how we build resilience and coping strategies. It doesn't need to be therapy. And not everybody needs what I call the therapy sentence, where they say, oh my gosh, go get outpatient therapy. There are lots of groups of folks who aren't willing to have that conversation. They don't want to hear that. Okay, great. Then let's talk about supports and strategies and how to build coping skills and coping strategies and coping with grief appropriately for the communities. And so we normalize it. We personalize it. If you can personalize mental health on a level, like I said, doing that connection and saying, wow, I can see where this could be difficult for your community. Do you know that we can do some mental health supports here? And we don't call it mental health supports. Usually we'll call it wellness. We call it a fun event. We call it something. We will host a fun event. It'll be a community fair and there'll be people there talking about wellness. That's the big buzzword. They call it wellness. Regina, I'm telling you, if you go and you see a wellness fair, there better be a mental health person there, right? So, and so that's part of what we're doing. They'll be doing face painting and talking about coping skills. That's what they're doing in these little tiny counties. I'm like, okay, tell me what's happening. Oh, we have the big ramp. We have ramps. We have these wonderful stinky garlic onion things. Okay, great. So that's a West Virginia thing, right? I'm not into it. I'm not gonna act like I am. But if the big ramp fairs are thing, I'm like, where's your table? Where's your table and what are you handing out? Can you hand out a bag of partner with your local food bank, partner with your local business, hand out magnets for 1-800 prevent suicide, whatever it needs to be. You hand these things out and you talk to people and just make the connections. Be there, host it yourself or partner. There's not a lot going on. And now that COVID is hopefully somewhat passing, people are just rushing in droves to do these community events. Unfortunately, I'm not gonna point any figures, but unfortunately that's resulting in a few positives in certain cases. But however, for the most part, people are ready to be out and about. And so why not us be a part of that recovery from the pandemic? So one of the big leads I want to leave you with today is have fun, mindfulness, wellness. It isn't always about somebody ramming mental health and wellness down your throat. It's about building connections and relationships and establishing resources for communities and families. So people don't always want to hear, one thing or the other, but have fun. Go face paint, go make balloon animals, whatever it is that you do. Let's have fun, build the connection, talk to people directly. And if you have people coming to you saying, well, I just don't really know how to reach this community, then your job is to find a champion that already lives and exists in that community. Because I'm not going to be able to reach people in Tucker County, West Virginia, but I know who will. So that's the important piece, is identifying your stakeholders and your champions. If you offer resources, sometimes I find that by offering resources, you get more buy-in because people need what you have. Once you have developed partners and resources, develop a plan, maintain your action items, maintain regular contact, and keep your focus. If you come into a community and you say, we have $100,000 to spend on ABCD, you're going to get a whole lot of ideas on how you can spend that money, or $20,000 on how you can spend that money in your community. Or if you have $0, but you have people who really care about your community and they will come together. It's kind of like the famous soup stone, right? So everybody can bring something to the pot. Keep your focus on what your goals are, because it's very easy to be what I want to call, hey squirrel, the attention deficit rule, where it's like, oh, that looks really good. That looks really good. So keeping a plan, keeping your action items, keep regular contact with your champions and your leaders in your community, keep your focus, and then ask your community, how are you doing? Ask for feedback. If I don't show up in my Tucker County place for, a year, they're going to say, we felt like we didn't get the support we needed because you weren't here. Or, we were doing great. We didn't really need you to show up. Thanks for calling us. And here's what we need you to do now. If you ask them, they will tell you. Do your focus groups, do your community asks. And last but not least, practice self-care. Because if you aren't healthy, you can't help others and you can't reach others. So that's kind of the big piece. I'm going to jump in. I know that I'm trying to be pretty quick here. We're at 12:20, so we're doing all right. So resource links. The Rural Health Information Hub, they have toolkits to reach rural communities. So mental health kits, suicide prevention, the National Rural Health Association, which I mentioned earlier, they also have Bridging the Gap. And one of the other pieces I like to use, these are ones that I use myself, the National Suicide Prevention Lifeline. It is 1-800, that talk line, that's important. It's national, you can call it. And they have free magnets, things you can just get mailed to you online, at least they used to. And I just pass them out when I go into places or have them sticking up somewhere. And I almost never notice people taking them off my table, but they're gone by the end of the day. So that makes me happy. And sometimes, I'd rather somebody call a number, even if it's not, if they don't feel comfortable talking to me, they have the number, they have the magnet, they have whatever it is. And so some of our schools are developing these little brown bags of what I'm going to call resources. They're the old county fair, like can openers and magnets for your fridges and cards. And they are including some of these resources in there, along with some of their local community resources for folks. And they're giving them away. Anybody who wants them, take the bags off the table. It kind of reminds you of going to state fairs or county fairs when you're a kid, So the Mental Health Technology Transfer Center, tons and tons of free webinars every month, every quarter. That's their charge. They are run out of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. SAMHSA.gov also has what we want to call a publications list. Tons, probably hundreds of free downloadables. You can get them to mail you free things. And these are all either substance use or prevention, early intervention, or mental health supports. Free stuff. Yes, absolutely. This PowerPoint could come to you. The ladies have it. If you don't mind, we'll send that out so that you don't have to scramble. Also, I'll put my email in chat. There is nobody that I won't connect with. If you want to connect with me, let's connect. If we want to have a Q&A about something, let's do it. So let me put up my contact slide and then let's chat about questions and answers, because I went through all that really quickly because I'm much better at conversations than I am presenting. So, but there's my contact. It's pittman6@marshall.edu. And I'll also put that in chat. That's a good question. Does anybody currently partner with local wellness teams? I'm going to stop sharing, ladies, so that we can go back to this. We have, I think I stopped. Okay. We have actually our little, so school mental health is kind of my thing. I need to end my slideshow. We have a website that we have a whole lot of just local West Virginia things. I didn't list a whole lot of screeners and things of that nature because I felt like that might be overkill and too much, and maybe people didn't need or want that. But there are lists of screeners. There are how to build community leadership teams. We have guides like that on that website also. Any questions or comments? I know that was pretty quick. Or ladies on the team have anything?
Thank you so much, Tiffany. This just reminds me of a conversation I had with one of my friends a couple of weeks ago. We were talking about how much stress our young people are under, and when we were young, I'm a Generation Xer, I think. So the amount of pressure they're under, the trauma, everything that's happening in the world, we didn't have that when we were younger. Just going to school, pandemic, family issues. So we were just talking about what can we do to better support our young people. I have a very close family member that had a traumatic incident not too long ago, and I was just like shocked and surprised because I talk to this person every week.
Yep.
And I didn't know.
So that is right in my wheelhouse. So two things. One, suicide attempts are up 31%. First of all, that is not good. There is conversation that, and I'm talking to schools, and just as part of, and I probably should have included this, but I thought this was part of the conversation. So part of the work I do every day is I interview and talk to schools and help provide supports at schools. We're talking about youth, students in anywhere between pre-K and college. Meet them where they're at. Go to the schools. Don't expect a student who is 17 or 18 years old who has no, I mean, I remember being 18. There was no way I was reaching out to anybody, right? I mean, it was much easier to go partying on the weekends and hang out with people at college or do whatever, which was not a productive way to handle life. But those are formative years. Suicide attempts, like I said, they're up 30-some%. So we are helping schools set up support systems anywhere between, gosh, we've got birth to 3 is a really good system here in West Virginia, but we've got that 3 years and up where we need these support. So we're helping set up prevention, early intervention, and treatment. And I mean, licensed mental health therapists in schools as many days as we can get them there. And we're trying to help match them with funding so that we can get these students supported in schools. I'm going to tell you right now, it's not enough. I wish it was. There's no, we could throw millions, I don't have millions, but we could throw millions at this, and we can't hire enough providers to see all the students who need seen. But they're trying. And there are some areas that they don't even have that support. I mean, Regina, you were talking, you know, we get a trauma call. I got a text this morning and said, hey, what do we have in Gilmer County? And I'm like, okay, you know, we don't have a big grant there that covers mental health services. So who do we have at the table? And so part of my job is figure out who's in that county that can help this school, that can help this student, you know, and I link them with the right people. In West Virginia, we are very lucky because we have something called Help for West Virginia.com. And it is a number that anybody in the state of West Virginia can call, and they can get linked to their local resources. So I did see a few people from Cabell County and folks like that are in here. That would work for you. But I would check if you're in a different state, see what your state has like that. What is your local Department of Health and Human Resources? What do they have? What are your local, you are a lot of health department folks, or you're tied to health departments. So see who are your mental health agencies in your state at the state level that are in charge and required to help make sure those supports are out there. Now I'm going to leave that right there, and you can come back at me on that one. I'm okay with that.
That was great, Tiffany. Could you talk a little bit about some respite for adults? Because I know we're in this, I saw this thing on YouTube about the Great Resignation, how people are just tired and done with it. They're just like, I'm out of here. And a lot of people, adults, we have to work, we have families, but what type of support or resources are out there for adults that we could probably access?
Okay. So the Great Resignation is on. I talked to a school yesterday. They had 17 transfers and resignations in the past 2 weeks. That principal is worried, and he should be, because they only have 40 teachers. That's almost half their teacher population. Okay. So yeah. And what I said to him was, oh my gosh, I don't know if I have an answer for that. But the biggest thing, what I'm telling folks is connect with people. People are languishing without connections. We feel like what we're doing isn't helping. We're not making a difference. And when you feel that way, or when you feel overwhelmed and like everything's on your shoulders, we check out. That's self-preservation. You know, you're not going to stand in front of a firing squad and wait on the bullets, right? Yes, people are tired, they're exhausted. So what resources are out there? I'm going to tell you, it's anything from what we're setting up in some of these communities, or they're setting them up. We're just saying, hey, they're surveying their teachers and their adults. They're some of the senior citizens organizations are surveying them and saying, what can we do to help support you right now? So they're asking. In some cases, they're having chili cook-offs and tailgates, and they're getting together to do yoga after school in a school gym or at a church gym. And that's what they're doing to connect. They're showing up and quilting together in some places. And I know that somebody's probably laughing about that, but that, you know, they're playing bridge, they're getting together with tea. We have Zoom calls where people make tea together and they sit and drink tea and they just talk to each other. Now, I know that that may sound not helpful. But for some of these folks, that's the only connection they get. Yeah, just having a fun day, laughter is the best medicine. But it is so easy for folks. It is easier for me to sit in my home and think about all the bad things than it is for me to step out and call Stephanie Montgomery and say, Stephanie, how's your day today? Let's talk about eating brie on the porch somewhere, because I can't take my day today, right? And so the hardest part is reaching out and connecting with folks and making it easy to connect with folks. It has to be easy, right? And sometimes you just have to push a little bit to do it, because I'm gonna tell you, none of us are on top of the world right now. And if you are, good for you. Tell me how to do it, because, you know, after watching the news this morning, I'm feeling pretty defeated myself. So I feel you on this. So yeah, so I think it's literally personal connection, Regina, and that's the supports, and it's offering it any way you can get in touch. If you're trying to connect with our senior citizens, I get a hold of Meals on Wheels and say, tell me who you have that doesn't have family that needs to get to the grocery store, you know, that sort of thing. If it's, you know, your single parents who are working 2 jobs, trying to make it through the day, offer the resources and connection, play dates for kids, you know, host a community play date on the local playground, you know, that sort of thing. It takes somebody with energy to do it. And you may not have one person show up the first time, but you're there having fun with your kids on the playground. Okay, great. Keep it going, be consistent, offer the supports consistently, because people will either eventually show up or you'll learn what you're doing wrong that you need to switch it around so that they will show up. So I don't know if that answered your question, but I think I got there.
Yeah, you did. I appreciate it.
Tiffany, you mentioned the faith-based community earlier. Are you seeing that how are they working with the wellness team? Are they providing the counseling? How are they networking?
Okay, so it depends on the community. In some communities, they actually have Christian-based counseling, and it is available for communities. I see that more in allergies, sorry about that, but I see that more in local, in like larger communities, but sometimes it's in local communities as well. They're providing backpacks, food programs, and they're connecting with students and families when they provide the food. They're saying, hey, here's a basket of food. I know it's tough right now. Our food banks are kind of low. And also here's a packet of resources. And in some cases that's coloring sheets for students on coping, or it's, hey, we're getting together to bake cookies together Monday on the stream. By the way, there's stuff in your bag if you want to bake cookies with us, right? Mm-hmm. Here's a phone number you can call. We have 5 other parents who are stuck at home and they don't know what to do this week. It's just that sort of connection. Sometimes it's verbal. They're providing transportation to and from after school and community groups. They're hosting movie nights on the side of the church where people can space out, but yet they can still be in an area together with socially distanced. I know that sounds, I don't know how that sounds, but but I'll tell you, in our communities, girl, we're Appalachian. If you feed us, we will come. So
Yeah, I'm glad you said the feeding part, because our church, we mentor up at the high school, junior high school, and for at-risk kids. But there's a lot of kids that stay after school just to be staying after school. That I like to say that all kids are high risk, because really all people are. Life changes on the dime.
Yep.
And so but we provide them a meal, and it's a hot meal, after school, because a lot of kids don't even get that. But, we partner with a couple of other churches, so we kind of hand it off and just kind of blend our talents and things. And then we just have a conversation with kids. We just sit down and eat with them and have a conversation.
And we have,
How's your day?
some churches and community organizations, it's not only faith-based, it depends on the community, but they're offering parenting classes. Hey, grandparents, supports for grand families or kinship care folks who are never expected to be raising another set of kids, and yet here they are. And so they're trying to connect and provide these supports for grand families too.
Yeah.
So I think our faith-based community is one of our strengths in Appalachia. It just is. But what we find is that when one person steps up, sometimes also here comes an art school or the beauty college or a museum or somebody like that comes in and says, hey, we could do pottery today, or hey, we could do art today while we talk about these important things. And so it becomes a community gathering of sorts. Sometimes it only takes one person to step up. And I find that our faith-based folks, we had a church that hosted a mental health first aid training and just allowed this training to happen in their church on a Saturday in the community, because they realized the students were in trauma because of the pandemic and things like that. And we had 30 teachers and community people just show up to do this training. It maxed out and filled up.
Wow.
And it's a 6-hour training. We're not talking 3 hours here. We're talking 6 hours of hard work. And these people showed up because they cared. And the church was happy to be there and happy to feed them.
So many of our, I look at the names and on here, and many of our coalitions that are on here, some of them work with school systems, others, work specifically on diabetes programs and self-management and things. And, when you look at that symptom cycle and, diabetes and depression is like this.
Yep, it sure is.
And so, I encourage our coalitions who continue to meet with their partners to, embrace that wellness team. And if they're not already on there, to get them on board, because some of you may have diabetes support groups. They can come and talk to it, talk to your groups. And I know several of you on here have health fairs all the time.
Yep.
So, I encourage you to do that.
And if you're working with a family or a person who has mental health first aid training, who do you talk to about that in Mineral County? Trisha, if you can connect with me, let me send you my email. One more time, connect with me by email and I will see if we have a trainer in your area, because we sometimes host where we can ask for free trainings. We're doing in Lewisburg shortly, we're doing an applied suicide intervention skills training. We're doing this because suicide attempts are up, completions, we don't like to see that. And so we had a medical center call us right now, actually, Stephanie, you'll know who that is, but they called us and they said, we need clinical suicide training for our staff who are in, who are coming in contact with these students. We have a few folks from like Fayette County schools are pretty going to show up too, but we have a medical provider coming to us and saying the depression rates are horrible. We need help. We need help with suicide intervention. Okay. I'm going to help you get that. So yes, mental health first aid training. It's teen mental health first aid, youth mental health first aid, adult mental health first aid, mental health first aid trainings in West Virginia. It was brought in by a big SAMHSA grant years ago. So there are still trainers around.
Thank you.
Yep, I can do that. And one of the questions, okay, Sheila, tell me again, because I did not answer your question, I don't think, or was it Regina? I didn't answer somebody's question just now because I got distracted by the, ooh, yay, Mineral County or Mineral, West Virginia.
You answered it. I just added the PowerPoint to the chat box, and then Stephanie Montgomery had a question about what do you do if you suspect someone is committing, a terrorist act against the school.
Okay. So
The reason I asked that was because in both of the recent shootings, people knew about it for a couple days ahead. Their friends knew about it. Nobody reported it. So is there information that all of us should be aware of? I mean, it's probably similar to if you suspect someone's going to commit suicide, but so I guess I had a couple questions. Do you have information on that? And then also, I can only imagine that there's a high level of anxieties in schools now. So do you have something prepared to share on that?
okay.
Thank you
So
for your hard work.
oh, you're good. So so the first question was info packets. There are, and I am going to have to Google because yes, we keep resources up, but National Child Traumatic Stress Network. I'm going to put this in chat. They often have resources for traumatic stress or traumatic events. They have an educator's toolkit. It's community resources or things like that. That is where I get some resources. SAMHSA, if somebody comes to me, I've had this happen. I had a student walk into my office and he said, I'm headed to the cafeteria. I'm going to see how many people I can kill before they tackle me. And I said, okay, well, that's one option. Let me provide a few other options and see if we can work through this today so that you don't end up dead and other people don't end up dead. And to my surprise, he stayed in my office. Had he walked out, what would I have done? My first call clearly would have been to the school administrators. That has to be, it depends on your setting, but one of your first calls has to be to the targeted audience. Okay. So if a student says, I'm going to kill A, B, C, D, or an adult says to you, I'm going to kill these people, the first thing I ask is, how are you going to do it? I don't say, oh my God, that's horrible, don't do that. No, because you know what? All you've done is that person's then going to walk away from you. I say, do you have a plan? Do you have a weapon? I'm super interested in what's going to happen. That is the first piece of mental health, is to determine intent and plan. Okay. That's not your job as lay people to do that. It is your job to say, wow, that's really concerning. Would you stay and talk with me for a while? Don't let them walk out with that weapon or with that plan. Okay. And then you say, okay, I care about you. I'm concerned about you. Let me get some help. And you call in your backup. And that could be a mental health provider. It could be the police. If that's what you need to do, Stephanie, that's what we do. I have sat at a school with a kid until the police got there because the family was like, nah, we're not going to deal with that. And so we had to call Child Protective Services and we had to call the police. He had a gun and a plan. I couldn't let that student walk out. Now, could he have taken that backpack that he had hidden on school property and killed us all? Probably, but it didn't work out that way because thank goodness he came to one of us first. If he hadn't walked in our office, I don't know what that day would have been like at that school. I'll be honest. So, so the first thing I do is notify anybody in that group. If I know that there's a school, my call is going to the principal, that board of education. Somebody's going to listen to me because I'm going to say, look, you have a valid threat toward you. I'm going to try to hold that student or that person in my attention area as long as I can to keep them safe while I'm having somebody contact Yeah, most of the people who have come in like that, they really, I don't think that they really want to go kill a bunch of people. If they did, they wouldn't stop by the office first, right? The ones who do, they're going to. What can you do to stop it? Police action. But do we have packets prepared for students and providing comfort and being alert? Yeah, there is. I'm going to be a big advocate. I do not sell this product. However, there's a product called Lifelines Trilogy. It is a suicide prevention, early intervention, and postvention, which means, unfortunately, if you have a suicide on campus, and this is all the way from usually middle, high, and college target, but it's the only evidence-based postvention program that I'm aware of in the nation. It's only $600. It's through Hazelden, and we routinely try to connect schools with that. Also, screening is a very good way. When I'm talking to schools and we're talking about screening for homicide and suicide, screen your students. All for that. You'd be surprised how honest kids are on a screening tool, because they really do want to help. If you suspect somebody's going to do that act, I'm not playing. If you tell me you're going to kill someone or yourself, that is not a joke to me. That is not playing. I'm immediately getting a hold of whatever authorities I need to get a hold of. In West Virginia, it could be Child Protective Services. If they don't move, I'm calling a medical. A lot of times our only recourse is to send them to an ER to be evaluated. That happens in a lot of our rural counties. And the emergency room can either connect with a psychiatric facility or not. Yesterday, Stephanie, we did a webinar from 2 of the psych hospitals in West Virginia called Kids in Crisis, When is Hospitalization Needed? And so we ran that webinar for like 50 some folks, and we're going to put it on YouTube, and I'll link it. But because people don't know, what do you do and when do you do it? They don't know those things.
Yeah. And even Tiffany, I was thinking in the 2 most recent cases, something was posted on social media. So I think it was 5 kids that knew for the grocery store shooter. One girl was alerted to yesterday's, and she just blocked them, but she didn't do anything with that information. So, is there a way to equip kids with a couple one-liners and then go tell somebody?
Yeah, so the biggest piece is going to be educating students and communities. I mean, I think grandma, if she tried to stop him, it didn't work out very well for her. She ended up being one of the ones who was attacked, but the young lady who blocked him, she's going to live with that, forever. So it's not good for her either. And when you're a kid, that's a heck of a weight to carry on your shoulders, knowing that you may have been able to stop something and then you didn't, and over 20 people lost their lives because of it. She's going to need therapy for a very long time.
Yeah.
So, but yeah, so educating people, saying, here's what you do. Just give them a phone number.
Yeah.
Tell them when to call 911. It sounds crazy, but putting it on social media, these kids are on social media, put it out there.
Yeah.
Honestly, I feel like Facebook and, Twitter and social media outlets should do a much better job of saying, if you see something that's a threat on Facebook, here's how you report it.
Mm-hmm.
But by the time they report it, it's a international platform. And then here you go. How do you get it down to Colorado or West Virginia or Texas? And how do you get it to the proper authorities? By that time, it's probably too late, but maybe not. 4 days ahead of time, 4 days lead time. That's a pretty big bunch of lead time to contact local authorities and say, hey, here's what this kid's posting on social media. So, so literally educating people on how, when to call, and that they're not going to get in trouble if they call.
Right.
So honestly, I plaster numbers over schools, grocery stores, social media outlets, movie theaters. I don't care. Those numbers need to be up just as much, just as the suicide hotlines and things like that.
Mm-hmm.
So yeah. And you had asked one other question, Stephanie, about, do we have anxiety kits, things like that? Yes. There are resources for anxiety, and how that is being met there are a lot. So I will say it this way, if it is something that's indicated and we've looked at a group of students and they are showing elevated anxiety, for example, we have programming that we can do. It doesn't require therapy. It doesn't cost money. And some of it can be done online, but we'll use tools like Coping Cat for parents. It's called Camp Cope a lot. It's a cute little animated cat program, and it's all about anxiety. It has amazing outcomes in students with anxiety in elementary and middle school. Or we will try to connect schools or communities or parents with resources. I say parents, I mean guardians, with resources that are online during COVID because you couldn't take people places. Sometimes that's group intervention with other kids, just building skills. But yes, there are anxiety, mental health technology transfer center, that one of those links I had in the PowerPoint. There are tons of resources for depression, anxiety. SAMHSA has tons of resources. Also National Institute for Mental Health. I'll put that in there too. They are one of the leading government agencies. Sometimes I'm a fan of government agencies, sometimes I'm not. It depends on if they're helping their people, but there's a link to them. There's a lot of mental health, and there's also health topics as far as autism spectrum disorder, anxiety disorders, eating disorders. There's a lot of resources on that website as well.
You know, Tiffany, you were talking about social media not doing, you know, good enough job. I think the media in general doesn't do a very good job. A lot of times at your movie theaters, you might see, you know, the 800 suicide hotline, but that's it. You know, it doesn't tell you how to do anything else. You know, if you see this, do this, you know, just like what you were talking about. And it doesn't take a lot of time, 30 seconds, you know, just to put that cartoon or whatever it is that, you know, for adults as well as students, because, you know, you get people, mass shootings and different things like that in the workplace.
Yep.
You know, it happens all the time. You know, so I think there needs to be, I don't know, is there pharmaceutical companies that connect with the wellness teams? And because they have, the pharmaceutical companies have all the commercials, you know, for treatment, but
They
not
do.
prevention.
They do, because, well, there's a whole lot of reason for that. But I will tell you that I won't go there too much. But yeah, I think that we could do better, because we can say, here's when, if you are in doubt, when in doubt, you know, you call. It's not when in doubt, don't. On this case, it's when in doubt, you do. You call people. If it's, and I've had texts from just, you know, I've done a school visit. Hey, how are you? Great, wonderful. And I get a text. I had a text yesterday from a principal, and she said, I need help. I don't know what to do. I have an elementary school. Do you know what's in the national news right now? Yes, ma'am, I do. Okay. How do I help my kids? How do I support them? Because, you know, there are kids who are afraid to come to school now all over the United States because of what happened in that elementary school. How do you support your students, and how do you tell them you're going to keep them safe when you're not sure that you can? I get it. I do. And, you know, so for her, this is going to be a large conversation. I did put a text hotline in here. It's a national crisis text hotline. This is for anybody, but there are numbers like this, Sheila, banking on what you said. There are veterans crisis lines, suicide prevention hotlines, crisis. It doesn't matter what kind of crisis you have, you can text this line. Kids love to text. They don't love to talk. So there are disaster. There are, on the National Institute of Mental Health, there's a thing that says contact social media outlets directly if you're concerned about a friend's social media updates, or you can dial 911. They're encouraging you, if you see social media pieces, to dial 911 or to contact Facebook and say there's a problem. I can tell you that the one shooter in Buffalo was streaming on a live platform when he went in. The live platform had it shut down within 2 minutes. of his stream, so they didn't catch anything violent on the stream, and they had him reported to local police within that same time frame. So that it was because viewers said, oh my gosh, this is not okay. Because people responded, the platform, it was Twitch was the platform, I remember clearly. They had it shut down, and they had contacted law enforcement in that space within a 5-minute period. That's an amazing turnaround for social media platform, I'm just gonna say. So, I think sometimes it can work. I shouldn't be critical, but I think that's probably an exception. I haven't seen Facebook responding that well to shootings that are being live streamed and things like that, but hopefully they can based on that response. They do have, I'm looking on here at National Institute. If you click under the mental health information tab, there's a lot. I'm not going to link it all, but the text line is one that I find most useful because it's national. And we have folks on here from all over. So. There are tons of resources, Stephanie, for anxiety too. YouTube has meditations and anxiety and breathing techniques, by the way. I found that really interesting that they have breathing techniques and things. Tufts Medical Center, TUFTS, they actually have breathing techniques. I thought that was interesting. Tufts University, I should say, School of Medicine. That's who it is. So if you look at their YouTube channel, Regina, some of that stuff might be 2 years old, 3 years old, 5 years old, but they have breathing techniques or de-stressing techniques or what we would call regulation techniques. I use them. They can be used for pain, but I use them for anxiety for my students and for my clients. It's like a breathing counting exercise. So it's all over the place. And if you have specific requests, you message me and I will send you more than you ever wanted to know probably on that topic. So.
There's a lot of apps too that you can download to your phone too for breathing techniques and
yes.
all that. And we have about 4 or 5 minutes left. So if anyone has any questions, final thoughts, now's your time to unwind.
I'm gonna leave that link to that Facebook breathing video there, Regina. So yeah, I appreciate it. If I can leave anybody with one thing, it's connect with people.
I think we saw through the pandemic how much that is needed for sure.
When we reach out, sometimes I don't know anybody in a whole community, but if I reach out, I've not ever had no one respond. That's pretty amazing. You get some person from the university going, help, we need help in this school, or we need help in this community. Maybe I'm just persistent, but I'm not leaving until I get help for that place. And so I'll find somebody.
Right.
Okay. You can do it. Hang in there, folks. You're making a difference, even if some days it doesn't feel like it. So.
Well, we really appreciate everybody that attended, and we'll send a link out and we're trying to get all the other resources copy, and we'll include that with the slides and Tiffany's email address if you haven't gotten it. So we appreciate you so much, Tiffany. Great job, and very, very good. Lots of information. So thanks, everybody.
Thank you all.
Thanks, Tiffany. Have a good day, everyone.
Bye.